community. Next, it is my distinct pleasure to introduce Trish. Trish is a breast cancer survivor who has agreed to share her story with us today. So, Trish.
Thanks, Joan. Hi there. As she said, my name is Trish Byrne. I live in Danville with my husband and two children, ages 11 and 13. Without a doubt, I am the happiest member of the panel to be here today because in October 2007, I was diagnosed with breast cancer. My diagnosis came out of the blue. I was a full-time working mom, active, healthy. I had no family history of breast cancer, and I had regular mammograms, the last one just 9 months prior to my diagnosis, and it was clear. And even when I found something in my breast, not a lump, it was more an area of hardened tissue, I felt it was more likely to be due to my advancing age and imminent menopause than breast cancer. And even after a mammogram, ultrasound, and biopsy confirmed breast cancer, I still felt relatively calm. The initial test results suggested that the malignancy was small and in a very early stage. So I opted for a lumpectomy, and from there the plan was to determine what, if indeed any, additional treatment was required. Well, the lumpectomy is when my world turned upside down, and it was the first time I fully appreciated that breast cancer is just an umbrella term, and what really matters is the type of breast cancer that you're dealing with. I had infiltrating lobular cancer, which accounts for about 12% of all cancers diagnosed. So I guess in some respects I'm special. It's a sneaky cancer. It begins in the milk-producing ducts, and from there produces long, skinny fingers into the surrounding tissue, causing a sort of a change in the structure of the breast. And obviously, this kind of a change is a lot more difficult to find than a lump, and it doesn't really show up on mammograms. In addition, it's usually larger by the time it was diagnosed. Mine was just over 5 centimeters, and the long chains of cancer that it had formed made it very difficult, really impossible for my surgeon to get clear margins in the lumpectomy. And the news just kept getting worse. It had reached my lymph nodes, and it was HER2 positive, which is a sort of protein, I believe, that promotes the growth of cancer cells. So I was facing a very aggressive, very fast-moving cancer that had reached my lymph nodes and was on a path to other parts of my body. So we needed a fast-acting, aggressive treatment plan. So within a week of the lumpectomy, I was back in surgery for a bilateral mastectomy. My decision, because the research showed that I had a higher likelihood of developing cancer in my other breast. And 2 weeks after the mastectomy, I began a regime of chemotherapy that was designed to wipe out the cancer, but at the time it felt more like it was designed to wipe me out. The hardest part of those early days was telling my children. I felt and really still feel that I stole something from them, an innocence that is at the very heart of childhood. Telling the rest of my family was easy. They're all in Ireland, and I didn't have to see their faces when I broke the news. And then from there, with my husband by my side, we decided to tell just a select group of very close friends. To me, it was important to contain the news of my cancer so that when my kids left the house every day start their lives, my cancer didn't follow them. So today is the first time that I've stepped outside that inner circle and shared my story with other people. Treatment was grueling, both physically and mentally. Apart from, in addition to the regular side effects, hair loss, eyelashes and eyebrows too. That was a bit of a surprise. Muscle aches, fatigue, tiredness. I had lymphedema or swelling in my left arm and hand, and I was plunged into menopause. And then just when I thought things couldn't get any worse, we discovered that the combination of the drugs had caused heart damage and that my heart was not pumping effectively. So we had to stop treatment. Being so close to crossing the finishing line, but being prevented from crossing it was devastating. And I really struggled at that time to continue the journey. The best decision I made for myself then was to start seeing a clinical psychologist to help me deal with the anxiety, the depression, and just to put things in perspective and keep going. So we waited, and my heart finally stabilized, and then we resumed treatment at a much slower pace so as not to put any further stress on my heart. And then I had to deal with radiation, but thanks to Dr. Kalmuth's magic radiation machines, he was able to deliver the radiation to the area of cancer while avoiding my heart, which for me was crucial. And I'm very happy to say that test results this week have shown that my heart has fully recovered. So that was huge. Thank you. All told, it took me until April of this year, or 18 months, to complete treatment. So I'm here today having undergone a lumpectomy, a bilateral mastectomy, 4 treatments of adriamycin, 4 treatments of Cytoxan, 12 treatments of Taxol, 52 treatments of Herceptin, 28 treatments of radiation, 3 breast reconstruction surgeries, 6 nuclear cardiac scans, 16 physical therapy sessions for lymphedema, and finally, and perhaps most significantly and currently ongoing, 20 sessions with a clinical psychologist to help me get my mojo back. So I want to say I'm not brave, I'm not a hero, I'm certainly not a Hollywood actress or a famous athlete. I'm a regular, ordinary mom, but I fought the battle of breast cancer, and I'm standing here today as a survivor. And I'm proof that the little guy can come out on top. And throughout all of this journey, I've gained some really valuable insights. And in the style of late night TV and David Letterman in particular, I'd like to share with you my top 10 list of things not to say to a breast cancer survivor. Number 10, most women gain an average of 5 to 13 pounds during treatment for breast cancer. Come on, talk about kick a girl when she's down. I've got cancer and I'm gaining weight. Number 9, this protective clothing I'm putting on is to protect me from the drug I'm about to administer to you. Wouldn't be good if I got it on my clothes or my skin. You have to understand that at the time it was being injected into a catheter in my chest into a major blood vessel. And you're protecting your clothes and skin. Number 8. In 30 years of measuring women's heads for wigs, you have the second largest head I've ever measured. Did I need to know that? I'm not really sure. Number 7, and I can see my husband squishing down in his seat when he hears this. I know you're going through a tough time, but it's just as tough for me. In hindsight, absolutely true. He lived with a woman going through chemotherapy and menopause. The man is a saint. But at the time, all I could think of was, has anybody ever used insanity through chemotherapy as a murder defense? But he's here today, so it was okay. Number 6, you had such lovely hair. Do you think it'll grow back? I don't know, and I don't really want to think about it. Number 5, why would you want me to reconstruct an A cup? You can easily carry a D cup. Needless to say, that plastic surgeon didn't do my reconstruction. Number 4, I love the Irish good luck charm that you gave me. I'm carrying it on my surgical scrubs and will have it on me when I operate on you. I'm sorry, a surgeon that needed a good luck charm, well, just kind of panicked me a little bit. Number 3, if you don't make it, Dara, my husband, and your kids can come live with me. I love a man about the house. I love your kids. Our kids are already really good friends, and I promise there'll be no sex. This was from a very dear, very good girlfriend whose marriage was crumbling at the same time that I was diagnosed. And she was just trying to help me cope, deal with the worst case scenario. She's still a girlfriend. Number 2, we are terminating your employment because you have been on sick leave for 12 months. That one hurt the hardest and was delivered in October, Breast Cancer Awareness Month. That's something I would love us to be able to change. And my number 1 comes courtesy of the Social Security Administration. The medical evidence shows that you experience discomfort due to breast cancer, lymphedema, lowered heart ejection fraction, weakness, fatigue, pain in shoulders and joints, depression, and that your condition has worsened. We realize that you do have some limitations and are unable to do certain types of work. However, your condition is not found to restrict you from all types of work, and your claim for disability is denied.